Hey guys, welcome to Real Talk Real Life, an initiative by Crown Cross Healthcare. Today we have a wonderful guest with us. We're going to be talking about mental health within the nursing space. We have Suja and Aaron today. Welcome, Suja.
Thank you, Aiden.
So I just want to get into how you became a nurse. So do you want to start like where were you? Were you in India or were you here?
Oh, okay. Um, I studied in India,
Mm-hmm.
northern part of India. In 2000, in 2000, I actually
Oh,
finished
2000.
nursing, and I moved to Malaysia when I got married
Mm-hmm.
with my husband. Then in 2004, we reached here in Australia,
Mm-hmm.
and then I started working in 2005
Mm-hmm.
in Australia
Mm-hmm.
as a registered or supernumerary practice first, and then
Mm-hmm.
um, into full RN
RNS.
positions. Yeah.
And did you get to pick a ward or was it wherever they put you? What was that
Yeah,
like?
I was in one of the hospitals in a ward for a
Mm-hmm.
while, and then I had my first child, and then had a bit of a break.
Mm.
Then I went back into another major hospitals um, as casual,
Okay, sure, okay.
so I can have the um, children, look after them, and work in the weekends.
Mm-hmm.
It's like a break
Uh-huh.
from home,
Yeah,
going to work.
nice.
And then weekdays I'll be home, and weekends I was working for a while like that.
Mm-hmm.
Yeah.
Cool. And then, so then you were in the hospital casual. Did you move anywhere permanently, like when your children grew up and got a bit older, or has it always been like this?
Yeah, I've been casual for a long time. Once they're grown up and out of primary schools, I decided to do more shifts, and then maybe 4 years ago, I think it was 4 years ago, I moved into cancer care.
Cancer.
I was drawn into cancer care for a while. I didn't I was going into that specialty to learn to do some more studies and
Mm-hmm.
get into that. But suddenly the COVID happened.
Oh, okay.
So I had been deployed to do a COVID clinic. So then um, after that, 2 years of there, and
Mm-hmm.
then I definitely decided, okay, when I get an opportunity, I'll get into cancer care.
That's nice.
So I got into cancer care in 2001.
Oh, okay.
Sorry,
Okay.
not
That's okay.
2001, 2021.
2021,
Yeah,
nice.
so 2021. Yeah. Um, what is the inspiration to go to nursing in cancer care is maybe my personal um, incidences in my life,
Mm-hmm.
like my best friend who was diagnosed with cancer,
Mm-hmm.
and also my sister-in-law
Mm-hmm.
um, around same time,
Okay, yeah.
and they all went through all the processes
There's the
of
chemo, radiation, all that.
all those different
Mm-hmm.
treatments. And then I was may not be so confident, but
Mm-hmm.
I was there to be a support person.
Mm-hmm.
So sometimes cook for them or just listen to them.
Mm-hmm. Mm-hmm.
Once I've gone through that, and when I realized how my my presence in their life
Mm-hmm.
was comforting them.
Yeah. Mm-hmm.
So I thought, okay, it is it is really hard when you think about cancer, but I think it is important to have people like that in their lives.
Mm-hmm.
So I felt a bit more confident, so I can go in and work in a cancer environment. I was really drawn into that after that. So
Mm-hmm. Nice.
I decided to apply for a job there, and I got it.
Oh, wonderful. So you're now obviously in the cancer field, but how was it for you? As you say, let's take it back a few years
Mm-hmm.
when you are just starting off in Australia. So you moved from India, you studied there. Obviously, there's a huge shift in culture, the way they do things, the surroundings, and everything. How was that for you mentally? Was that a bit of a shift? Obviously, new language and all, and maybe procedures and things were maybe different, or standards were a bit different compared to the hospitals. How
Yeah.
did you tackle that mentally? Was that a challenge to jump over?
Um, it is a challenge to because it's a we have to. Yeah, I was okay with English, but it is not a constant. The language was a bit of an issue to
Mm-hmm.
understand people from here
Mm-hmm.
because
Mm-hmm.
the slang is different, and
Yeah.
um, but I think we grown into it, and this is the choice I made to stay here. So I have to work for the family. So I have to
Mm-hmm.
learn and do work. And also the culture in here is entirely different in such a way that it's very supportive.
Okay.
um, Here it's like you you may not feel um, that you are being pushed back because you are from a different background.
Mm-hmm.
You were being in, especially I felt in healthcare. I think there's a lot of migrant nurses
Mm-hmm.
in Australia, so there is always a welcome for nurses in the
Mm-hmm.
healthcare sector, especially. I think there wasn't, we didn't feel from our colleagues or from our superiors, they didn't feel any um, treatment difference with
Okay.
others. So we've been supported, we've been given opportunities and um, help to overcome that
Mm-hmm.
situations where you felt it is difficult. They have been given more training or more support when you need
Mm-hmm.
it.
Wonderful.
So if you are really interested or wanting to learn, there
Mm-hmm.
is always support available.
Mm-hmm.
So
Mm-hmm.
you just have to ask for it,
Ask for
or
it.
someone has to tell you, okay, this is available. But
Mm-hmm. Mm-hmm.
most of the time, yes, we have to ask for it to see, okay, you need to go and search for it too
Mm-hmm.
to get it. But I don't feel there wasn't any obstacles as that racism or any other concerns
Mm-hmm.
which I had in my career.
That's
Yes.
so good to hear. And obviously, COVID, you mentioned that you were in COVID clinic, and that was a time where the sector was really pushed because, there was a lot of understaffed already, there were all the issues already. And then we had a big overhaul of the system, and it took a lot of toll on, especially the nurses, like they consider the backbone of the hospitals and the system. So, where were you in the COVID scenario? COVID clinics, were you just there as a manager, or were you there just working?
I started off because I was well into my career by that time. I was casual for a
Mm-hmm.
long years, so I've known to. I have been working in quite a few
Different
hospitals,
sectors, yeah.
different sectors, and so I was a bit confident to do wherever I've been pushed to,
Mm-hmm.
because I'm constantly moving to one ward to other,
Yeah. Okay.
or one hospital to other. So I wasn't really new to a change.
Mm-hmm.
So when I've been asked to, okay, we have to open up clinics to test people or run the COVID clinics, it was a bit challenging.
Mm-hmm.
But I just decided, okay, let me go and see what happens.
Okay.
So,
Yeah.
so I was running the clinics. I was the associate nurse manager there, but
Mm-hmm.
that is actually really a really hard job. It's a really challenging job at that time
Mm-hmm.
because of the stresses of the people, mainly
Mm-hmm.
because there's a huge amount of not knowing what is this, or what is going to happen to them if they get. So there was a lot of unknowns at the start.
Mm-hmm. Mm-hmm.
So people were panicking,
Yeah.
they were upset and angry. Um, so that was on us. It may
Mm-hmm.
not be what we did or what we didn't do. It
Yeah.
was mainly because they were upset about the whole situation. They can't get out, they can't
Mm-hmm.
do this, or there's a lot of restrictions. And then when they come out, they have to wait for things, and that makes people frustrated.
Mm-hmm.
So that sometimes they put it on us.
Us.
That's
Mm-hmm.
so that's quite a bit of uh, safety and also verbal aggression
Mm-hmm.
the nurses faced
Yeah.
at that time. But I think as a manager, we had, or as an organization, we had a lot of things in place
Mm-hmm.
to help us to run it okay. But there
Okay.
was challenges still. There was a lot of help. There are days I stayed long hours
Mm-hmm.
to get through the number of people come through, and it all takes a toll on your mental health because you are constantly in go mode.
Mm-hmm.
That because of the either the staff, there's a lot of staff members to handle, there's food and water, because it's outdoors
Oh
mainly.
yeah. Yeah.
It is a lot of heat when it was summer,
Mm-hmm.
it was raining sometimes, all these physical or the weather challenges as well. So it's a lot of things to manage and think about,
Mm-hmm.
and we have to make the staff safe. So there was a lot of things during that time which challenged a lot and was stressful. My husband used to say, "Oh, why aren't you not sleeping well?" So because you are constantly thinking what to do next and what happens if, what can I do better tomorrow to avoid these problems, people complaining, staff complaining. So that was a stressful time for me, but I think talking about it did help. It's not as a complaint or thing, but just venting it out to someone, or just someone to listen to, or have someone to listen to. So I think either in first situation or in the COVID situation, I think having someone to talk to is always the help for me
you,
to get through that stress situations. I think, yeah.
So obviously you mentioned all the weather challenges, and obviously that will bring about a lot of the term I find is burnout. So you'll be always in the go mode, like you said, and then there'll be a time where it's like a crash, almost where you push so hard that your body kind of give up. So were there any signs of that, and how did you push through that? Even though obviously you had to go through patients, you had to go through the longer hours. What was it you do other than venting as well, like to someone coming to talk to?
We do have to escalate issues because there's we are not the only one who is going through it. So we have to really escalate. If you can't cope, you have to escalate and tell them, okay, I can't do this, or we need to have a break. So there is always help or support available. Sometimes it's hard to get, but you still have to ask. You have to have that. You have to set your limit. Okay, this is what I can handle. Anything more, I'm going to not be handling it well, and the situation will not be in my control, and I can get emotional and upset, and then it can affect other people around me. So you have to understand your limits, and then you have to ask for help. I think that is very important in any mental health scenario. It's your confidence to ask for help. So you will ask for help only you feel like, yes, there is someone is listening to you and they are willing to help you. If they are not, okay, it's okay, you will get over it, just come to work again tomorrow, then you will lose that confidence in them that they're not going to support me when I'm crushed. So how I'm going to work again into that same scenario. So I think you have to have that confidence in yourself, and also know your limits. At the same time, you have to have the confidence in the people above or your managers to see that they will listen to you. So the culture should be a very good one, which is listening to each other and understanding your limits. That will make it really good for mental health for any nurse.
So we looked into like stress and burnout. So 2021, you got into the cancer side of things. What did initially we've looked into the employee side of things. So as a nurse, you're working what services they provide as an organization. How do you deal with it? You worked into the cancer side of things due to like personal things that happened in your life with different friends and family. What did the mental health side of things look for patients in that time? So in that area, sorry. So within the oncology ward or within that, wherever you're working, what was the support that patients got? Because obviously it's a very tough time, because it could lead to even worse consequences. So was there anything provided for patients, or what did that look like?
Okay. Yes, as a oncology nurse, I would proudly say yes, there is a lot of support available for the patients when I understand really well that it is a really life-changing situation for them. So it is very emotional, very anxious, anxiety-filled. Most of the people distressed. So we do have comprehensive care that is physical, emotional, mental, social, and spiritual aspects of care has to be provided for everyone. So there is an assessment when they first diagnose that what are the support services they need to have, to assessing all these sections of their life, to what are the supports they need, what are the physical struggles they have now, and what we have to do about it, and then what are the emotional problems and social problems they have. What is there any transport issues? Is there any financial issues? There's lot of things, the life is changing because there's a diagnosis, then there's treatment, different processes of it. It's a long process, so they need to get through it. So we assess all of it, and then also mental health problems, how distressed they are. Is it, some people are very good at managing their stress levels, but some are not. So we just have to ask them the questions in a such a way that we can assess in a really well way, and then we'll refer them to either social work or counseling, or if it is a really stressful situation, or according to their distress level, we even send to oncology. So they have been given referrals, but there is a hold or waiting list, kind of like it won't be an immediate, but there is other support services outside the same organization. There is cancer councils, Victorian Cancer Council, and other specific organizations which they run to help and support patients. So we do have to refer to them and give them the information. Okay, these are the support services available. You have to have the consent of the patient to refer to them. You have to ask them, okay, this is what we can provide you. Are you willing to take that? Many of them will take. Many of them is just a start, and then once they know what's going to happen, I think they're quite settled. So it is just that it is our responsibility as nurses who look after the patients to assess them clearly and really well, so we can refer them to further care and support services, which they can get more support. They do find it's really helping them mentally when they come to us, and because they come to us during part of their treatment quite frequently. So during that time, they feel it's more comfortable because they can come and talk to us, and we have a
familiar face every
it's
time
a face at a time. So that is good, but it's also important that after that prime part of treatment, when they are either in recession or remission, or not having treatment for a while, need to still have that contact and support. So that's where we, at the start and also at the final time of their treatment, we do have another assessment and further referrals. So that there is support a lot available. It's just that many times people feel uncomfortable or feel like, okay, what if I ask for help? That the others feel I'm not capable or strong enough to go through this. And there is sometimes a dilemma, but I think many people have a lot of family support. So if you have a good family and friends circle, and they are very good at helping out and talking about things, I think that helps them a lot. There are a lot of patients who say that. There's a family and friends around they can talk to and share things. They're quite good in maintaining their physical health and emotional health, and get through the treatment without not many complications. But there are people who doesn't have anybody to look after them, or doesn't have a family around, doesn't have children around, or by themselves. So that is harder for those vulnerable ones, where it is really hard for them to access help and to call. For us, it's not possible for us to be 24 hours on call. There is some people, but it's not feasible for them to call all the time. But those kind of people will have struggles to maintain that physical health and emotional health during their treatment, and they can fall out. They sometimes they can't even finish the treatment because they can't get through. It's because of the toll they have to go by themselves sometimes. I think it's very important for us to pick and identify and get more support. And also they are being by themselves and managing everything by themselves quite a while, and then suddenly they can't. Then they are like, oh, what how do I get it? So it's really not knowing, and also not feeling like, oh, I have been doing all by myself. Now
Yeah.
I have to ask someone. I don't want to do
Yeah.
that. They don't want to give up their freedom, or asking for help is not the thing for them.
Yeah.
That is, yeah, very,
Yeah.
very sad.
Yeah. Has that ever been not an issue, but when you have obviously more newer nurses, you're more of the senior nurses within the oncology space in your ward. So would you say that when you have more newer nurses or people just come into the ward, it was harder for them to deal with certain aspects of the job? So seeing patients coming day in, day out, coming for treatment, and then seeing how they are. Was there ever a moment where a nurse felt so overwhelmed from seeing the patients how they are, and how did they deal with it, or how did you guys as a team, a community, deal with that as an issue?
Yes, there is always a chance, or people cannot handle um, patients, though they connect so much to the patient scenarios, or
Yeah.
talk, and then, oh, it's a sad situation, or really emotionally affected by it.
Mm-hmm.
um, uh, but I think most of the people who select oncology,
Yeah.
I think they do have a bit of an understanding. Oncology is a hard space to work,
Mm-hmm.
because you've got connection, and they know the uncertainty of the future, or there is sort of certainty nowadays. There's a lot of different treatments, and
Mm-hmm.
there's the always better chances and good care
Mm-hmm.
nowadays. But I think when everyone hear about oncology, everybody has a fear. Even anyone who asks, even though there is a lot of um, uh, progress in the care and
Mm-hmm.
the medications and everything, I think there is still a fear in people about it. So
Mm-hmm.
when they don't come just because there's a lot of grads coming out every
Yeah, that's
year,
right.
but I don't think many are choosing oncology because they're
Mm.
still, oh God, how am I going to handle this?
Yeah.
Because I want to see these people, I'm going to treat them
Mm-hmm.
in
Mm-hmm.
and out.
Yeah.
So sometimes there are people
Mm-hmm.
emotionally get upset after a busy shift of seeing all this. It's mostly because of the amount of things they have to arrange, and the physical workload, or
Mm-hmm.
not physical, the emotional workload they have. They
Mm-hmm.
have to assess the patients, identify any problems, and then have to make sure that everything is correct for
Yeah.
them. And then your brain is on all the time,
Mm-hmm.
and you can't switch
Oh.
off while you're working. And it takes a toll after, if you're continuously working, if you don't have any mechanisms to relax, or
Yeah. Mm-hmm.
to get rid of that stress levels. I think there are people who have seen maybe a couple of people who emotionally break down after their huge or busy shift.
Mm-hmm. Mm-hmm.
Um, Mainly, we give them some space first.
Yeah.
So ask them to, okay, if you're not feeling great, just go home and rest up. And then when you're ready to talk about it, we are always here. Just come and talk to us about it.
Mm-hmm.
And there are well-being services and services available. And as an organization, it's as per the rule and regulations. There is a lot of well-being services available in any organization. So
Yeah.
you have to guide them towards that services.
Mm-hmm.
Or if they just want to talk, non-judgmental person to listen. They just wanted to have someone to listen
Mm-hmm.
without judging them. So they're
Mm-hmm.
not feeling that they're very weak, they can't work here, they
Mm-hmm.
can't
Mm-hmm.
deal with the issues. Not thinking like that.
Yeah.
Just they had a bad day, they just want to talk about it. Just non-judgmental listening ears.
Mm-hmm.
That is many times that's all they need.
Mm-hmm. Yeah.
Sometimes they need more help. Very difficult situation, like any errors or any difficult deaths or traumas or things like that. They probably need some more help, where
Mm-hmm.
we refer them or send them to the wellbeing services, and they can provide counseling services and free services, I think. Yes, it is free services for the employees. So they just need to take access those
Access to
ones.
some.
Yeah, it's always
Yeah.
self-available. Yeah.
Yeah, that sounds. It sounds like there's something there, which is
Mm.
great to hear. You mentioned grad nurses. What would you say a tip for new upcoming nurses, grad nurses, something that you've gotten from your long career that you would like to give out to all these grad nurses, something that they can take in when they're finishing all third years, second years, they're finishing their studies, they're getting into the workforce, they have to be accountable for certain things. What's something you would like to tell them?
Okay. I'd love to have new nurses come out because they're fresh in their head, and then they're willing to take up a lot of their, like, same as we talk about kids, it's like sponges. They just absorb things, which is really good to see. So I want them to be proud of themselves. They're working in a very difficult scenarios and for the life of people. So even the mere presence of them give the other people, the person, a lot of confidence and comfort. So you have to be very proud to be there, and as a nurse, to be there for them. So I want them to take pride in their work. And then to be very good in their knowledge, attain knowledge from wherever they can, put more time and effort into attaining more knowledge about whichever field they are going into, wherever they are working. So knowledge is that gives them the confidence that, okay, and look into policies and procedures and learn from others. So they have that confidence in themselves. Okay, what I'm doing is, I know what I'm doing. It is not just, I think it will work. No, I know what I'm going to do. This is what is research told me, and this is the evidence-based practice I'm doing. So this is how it's. So that confidence in yourself will give confidence to your patients. So when you talk, if you show that what you're saying is right and you're confident in it, the patients or the people will listen to you and will have confidence in you. That will, because the patients should have confidence in you, otherwise they won't feel comfortable with you. Unless they feel comfortable, they are not really taking in the care. Whatever you're giving is just not a chore. There is a spirit in it, and also there is a lot of love and care in it. So keep that, attain the knowledge as much as you can. There's a lot of knowledge available wherever you are. So you have to find time to do it. Don't think that, oh, I have to study, I have to be given time at study at work, so I should be studying only at work. No, you have to have a professional development plan to have your own time to study more. So that will give you a bit more confidence in what you're doing. And then emotionally, to support yourselves, is when you come into scenarios where you think it is stressful or can lead into mental health difficult situations or mentally difficult situations, have someone in your life, or have confidence in have good friends which you can talk to. Have someone who would listen to you, or find someone even at work who is seniors to you, can mentor you and talk to them, who can give you guidance to help to manage these scenarios or situations where you feel like anxious and upset and things like that. And also it is a culture of different departments where you are. Are you really a culture where you actually will give support, not judged on there? So there is a lot of I've done a lot of studies, and also with helping out, because I'm in a senior nurse position. So where you give them, the people have to behave their 100% when there is mentally healthy place. So that is the freedom they have to do what is the best of their ability. They'll do their best if they feel like they're not being judged on. So yes, you will be judged if you. It is not judgment; it is an evaluation. You will have an evaluation on people, so that evaluation will guide us to help you to move forward and get better at if whatever shortcomings you have. But it is not for categorizing you, say, hey, this is not good enough, or you're not good enough, you can't work here, or it is not the judgment. It is the judgment, but it is that's not the judgment we are after. So we are just going for an evaluation sometimes to see where are the hard situations or where you're not really good at, that you give you support so you can be good at that every section of the nursing. And if you need help, I'll promote everyone to ask for help.
Awesome.
If you're not feeling good about something, just ask for help or bring it out. If you're seeing something which is not good, point it out and say, okay, this is not good behavior. If you are seeing a bullying character, you have to speak up and say, oh no, this is not. So you have to give them the courage, and I'll say, okay, have the courage to speak up when you see bad things, and feel free to ask for help. That will give you a lot of what do you say? It can go a long way.
It'll go a long way.
Yeah, as progressing in your life and progressing in your career.
Career as a nurse. Nice.
Yeah.
Well, thank you so much, Suja. Really appreciate it. It was very
Thank you.
insightful. Thank you all for listening. Next episode, we have a cancer survivor with us. So please stay tuned and please listen. Thank you.